Hello, everybody, and welcome back to the show. This episode is brought to you by The Wellness Paradigm, a holistic health coaching company shifting the way that women understand and heal their bodies. Through bioenergetic testing, functional lab testing, and functional nutrition, we uncover what traditional approaches often overlook so you can stop guessing, start healing, and finally feel like yourself again. No more one size fits all protocols, just real answers, deep rooted healing, and the clarity and confidence you deserve to feel incredible. It's time to shift the paradigm of women's health. Now, on to our show. And good morning, Molly.
Good morning.
I'm so grateful you're here, and we could have probably had like a mini podcast episode just from chatting earlier here.
Yes.
Um, but this is going to be such a fire topic, such a common topic. We're going to explore, weight loss, GLP-1s, and under this really beautiful, holistic lens that you offer. And so she is actually a nurse practitioner and owner of Lupo Preventative Medicine, a private practice focusing on science-based solutions for weight loss with medication management, as well as Lupo Wellbeing, which is a private coaching practice for women focusing on nutrition and lifestyle changes. And, I joked with you earlier. I was like, man, I want to bring something on my podcast about speaking on this and speaking positively on this because there's so much misconception when you're in this holistic health space that GLP-1s are bad or medications are bad. And for the right person, right time, this can be incredible. So, give us a little bit of background on who you are and how you got started in this line of work.
Yeah, so long story short, I started out in oncology actually as a nurse practitioner. Everyone there who's like getting these life-threatening diagnoses, right, are asking like, how can I be healthy now? Like what can I do? And in a 15-minute slotted visit at a medical center, there's just not time to go into it. And so long story short, but COVID hit. I was pregnant with our third baby. I started my own clinical practice at that time instead of going back to oncology and academic medicine. And at first, I wanted everyone to do nutrition and lifestyle. It's like what I really wanted. I was really into American College of Lifestyle Medicine, all of that. But I just like quickly learned like this is more nuanced than calories in, calories out, of course, like it matters, but there's just so much more to it, right? And so I joined Obesity Medicine Association. I did their certificate for advanced practice providers. And it totally just opened my eyes to just a different perspective and science-based perspective for weight management. And so my clinical practice is now focused solely on weight management for women. And so that's what I do on that side. And then at the same time, I aim to empower women to also focus on nutrition and lifestyle and fitness, things that they can change that's within their power, right? But maybe a once a month clinic visit to talk about your medications is not enough support for that. So that's where Lupo Wellbeing was sort of born, because I want to sort of like integrate and meld the two of them, and be able to give women the support that they really actually need to make meaningful like behavior change, lifestyle change that is actually sustainable.
Mm. I love that because we see so much about just medications, right? Or just lifestyle nutrition coaching.
Yes,
Blending the two is sometimes absolutely needed. And,
it's 100% needed. Should not be one without the other.
it really should. I've had this conversation with a few people where it's like, we have had clients we've talked about that we partner with a medical clinic too, and it's like that are on GLP-1s, and it's every single one is like, thank goodness I'm doing this program still, right?
Yeah.
Even though they're losing the weight because there's so much physiologically, mentally that goes on. And it's also, I'd love to know your thoughts on this, on whether this is a lifelong thing, whether this is something people like to taper off. That's a huge question you probably get. How long do I need to be
Yeah.
on these things for?
Yeah.
Right. And then so it's understanding too how to actually train your body to work more optimally because medications alone, yes, you can lose a weight, doesn't mean you're going to feel your best. Right. So I'd love your thoughts on this.
Yeah. Which question do you want to start with?
Right. Let's start first with um, how long people have to be on GLP-1s for. I think that's a common one.
Yeah, this is $1 million question, and everyone wants to know, and everyone should be having this discussion at initiation, right? It shouldn't be, okay, I've lost the weight, now what? It should be a discussion at the beginning. So, in the studies, they absolutely find when people go off these medications, they not only gain the weight back. A lot of people even go further beyond like that original set point, right? And this was one of the reasons why when I originally started my own private practice, I didn't want to put anyone on them because I was like, well, you are just going to gain the weight back. But truly, if you look at the science underneath of it, um, obesity and weight management medicine is a chronic disorder. Now, as far as who stays on, who tapers off, it's so vastly sort of different for each individualized person. And I tell people that. So, this is what the science shows, right? Likely there will be some weight gain back or even beyond. But also, I'm a firm believer in empowering people for their own autonomy to make their own decisions about what they want for their life and how it looks, right? And so, let's say that you are someone who wants to lose the weight and then you want to taper and see how you do at lower doses, maybe even go off. Totally fine. We likely need some some pieces locked into place if we're going to tread that water. We want to make sure that nutrition quality is there. We want to make sure nutrition timing is there. We want to know how sleep quality is. We want to know what are the stressors, what's like driving you. Is there any like emotional eating? Is there any binge eating going on? Those things are super important to ask about and to understand. So without those, things can go south real quick, right? Another piece of it is what are you doing for activity? Like we know from the 5-year national weight loss registry trial where we have people who've lost significant amounts of weight and they've actually maintained it, they actually exercise closer to 300 minutes a week. So right now, the American Sports of College Medicine recommendation, general population, 150 minutes of moderate activity a week, 2 days of strength training. But for a population who's losing significant amounts of weight and they actually want to maintain it, which is the key, you want sustainability in this. They likely need more movement than just the 150 minutes. We find that in the data. We find that in the trials. And so do you start at 300 minutes? No. I mean, you start where they are and asking like, what are the tweaks that you want to make here? How do you want to, change it up? How do you want to add? And you let them get consistent with that and then you build, right? But then I 100%, I would say that most people who start at least a GLP-1, um, once they start them, they come back and they say like, okay, we've like figured out my goal weight. We have a maintenance dose, whether it's, a lower dose, and maybe we're extending it. Maybe we're doing every 10 days, every 12 days, every 14 days. Maybe they're doing the lowest dose just once a month, right? There's no clinical guidelines for this, but this is like where we're at right now in this space and time. But most women who are coming to me will say like, I don't want to go off of this. This has changed my food noise. It's changed my adherence to things like the story I tell on every podcast is I wanted everyone to do nutrition and lifestyle. Finally learned about the anti-obesity medications. Started a woman on a GLP-1. 1 month later, she comes back. She says, is this how normal people feel? I say, tell me more. She says, well, before when I was just trying to do nutrition and lifestyle, I was so hungry at night, right? Because we know ghrelin, our hunger hormone, goes up when we are actively losing weight. It's the brain and body's way to protect the body. It like thinks you're dying. And her satiety hormones are going down, right? So she's hungrier and less satisfied. A disaster. And so she comes back a month later and she says, like, is this how normal people feel? Well, because I'm not so hungry at night, I'm not undoing all of my work from the day. Because I'm not as hungry, I'm actually sleeping better. Because I'm sleeping better, now I'm getting up to exercise. And that was like the nail in the coffin for me because I was just like, this is life changing for people, right? And it's not that people don't know what to do. It's that hunger and satiety hormones get so dysregulated, not only in weight loss, but like, look, women aren't coming to me with their first weight loss attempt. They have tried to lose weight over and over and over. And maybe they have lost 30, 40, 50 pounds and then they gain it back and then they lose it again and then they gain it back. And that is a frustrating experience. So we want sustainability, we want longevity in this, and we want them to be able to integrate the nutrition and fitness and lifestyle like pillars alongside a medication, if that's what they want.
Yeah, absolutely. I love that you mentioned the strength training. That's one of the biggest things because we know, and I don't dive into the research quite as much as you do, I'm sure, but like muscle mass is one of the biggest things people lose initially, right? And why they lose it so fast. And metabolically, you burn a lot more calories at rest having more muscle, right?
Yeah,
So that scientifically is why you need to keep that muscle
right.
mass up. Most people will do it too because of, I don't want to get saggy skin. Love that, right? But also
Sure.
just there's a lot of science behind like why it's actually
Yeah.
important to build that. Not to mention just longevity and
Yeah.
health.
Yeah.
Um, Now there can be some side effects of these medications, right?
Hmm.
And so when you're consulting with somebody, what are the biggest things you're kind of looking out for where somebody could be a really good candidate versus maybe not a good candidate for these meds?
So, baseline qualifications is a BMI 27 to 29.9 with another co-occurring obesity related disorder. So, like high blood pressure, cholesterol, insulin resistance, um, sleep apnea, all of those things, right? And then BMI over 30 just qualifies you.
Mm,
Now, qualifying and having insurance pay are two different stories. So, um, the company that provides whoever's, healthcare benefits you're getting them, they decide, that team decides, are we going to include or exclude these on coverage? If they exclude them, there's no way you're getting around it. You're looking at cash pay prices.
yeah.
If they include them and you have coverage, you have won the lottery because these are
Yeah.
expensive, right? But that's kind of the starting point. The other sort of caveat here is like, let's say someone comes in with a BMI 24, they're within the guidelines for normal. And look, I know BMI is antiquated, but it's what insurance uses to base these things off of. But let's say that their highest weight was actually like a BMI of 35 and they are really struggling now. So that's a place where I will sort of get into the nuance. And I tend to, and in the obesity medicine world, we use like the highest BMI for our diagnosis. So that's one thing that we think about. Um, what was the question? Who's a good candidate? So like that's one thing. Body composition testing is becoming very popular for
Mhm.
good reason. We want to look at body fat percentage to lean muscle mass. Um, and beyond that, okay, so side effects. So side effects, of course, with any medication can happen. I will say that if you are working with a clinician who you know, they're starting you at the lowest dose of these medications. And like I see my patients once a month. I know not everybody sees them that frequently, but I see them once a month because I want to know what is the rate of weight loss. You still want to target that half pound to 2 pounds a week. And I do see the scales tipped, at least at first, with like going over that 2 pounds a week. So that's a piece I'm kind of keeping an eye on. Other side effects, the biggest ones I think are just constipation, nausea, stomach upset. Um, and the best thing that, and honestly, the thing that I think helps most with that is consistent eating patterns and nutrition quality. So on that note, I we have a local dietitian who will work with insurance. So that's like a very nice piece of the practice that I can partner with because then they can work with her at the same time that they're working with me on nutrition quality, all of that. And I'm sort of screening people for all the other things that go with weight management that no one's paying attention to: anxiety, depression, ADHD, all of
Mhm.
these things, because they can make an impact on weight management and your goals with it. And so also seeing like, do we need to get a therapist on board? Do we need to think about medication for some of these other things, depending on how much they are impairing or like affecting that person's function day to day. And then the other piece I see quite often is just like fatigue with them. Like they just feel so tired. And I truly, honestly think that when that fatigue is hitting, it is more so likely about nutrition quality, timing, and hydration status. Because with decreased hunger, we have decreased thirst. So if they're not being intentional about like water intake, I will tell people like the day before your shot, like make sure you are super hydrated. That's one little caveat that seems to help a lot. And then the other piece of it is just the nutrition quality and timing. So like if someone's telling me like they're tired all the time or like the constipation is like so bad, I'm looking a little bit deeper here. Like, are we getting enough fiber? Are we getting enough nutrients in the body? Because to me, when I hear you're fatigued on the GLP-1, I think you're likely not getting like adequate sources of like minerals, vitamins, your protein, your starchy carbs, all of that. And so many people just fear carbohydrates, and that's where working with a dietitian or someone in the space who can help them make sure that they're like eating at regular intervals, balancing the plate, like doing the things. Because the last thing that I want for a patient or client is to start a GLP-1, tank their appetite so much that like they're eating one meal a day or they're skipping meals. Like calories are energy. You want energy, we got to feed the body. We just got to figure out how to balance it.
I think that's one of the hardest things too, as a functional nutritionist, somebody that, works, and I know you've worked too, where it's like, we're used to traditional things like cutting, reverse dieting, maintenance cutting, fat loss phase. Everybody has different names for them, right? But, you know, I know with clients, like they don't have an appetite. But it's like, well, we still need to be eating, and or if we've been on it for a long time, we know we have to revert that metabolism back up and train their
Yeah.
body to effectively, learn how to burn more calories again. But how do you navigate that when someone doesn't even want to look at food?
Yeah. I think that is the rub, and that is the conversation that has to be ongoing and happening at every visit because, they get excited because they start losing weight, the food noise is gone, they're feeling like so good. But then if appetite is not there, we need to think about the dosage. Like, do we need to go down on the dose? Do we need to space the dose out maybe a little bit more if you're already on a lower dose? I have a woman right now who she did like her maintenance, like we figured out where her maintenance calories were, right? She's on a GLP-1. And then we went to do her cut and she's so at at maintenance she's complaining, well, like I'm not even hungry. Like I can't eat this much, right? But then she goes into her cut and she says, "Oh, I'm so hungry now." And you start to look at like what they're eating and the quality wise. And the problem is like all this marketing garbage around like protein Pop Tarts and protein this and protein that. And it's like, can we incorporate some whole foods here to help promote that hunger and satiety balance for those hormonal processes that are happening? So anyway, she switches her breakfast up from like protein cookies and collagen coffee or whatever. And I'm not like trying to like make fun or anything like that, but like we have to look at the quality. And I think in weight loss, it is so much easier, not easy, but it makes it easier to lose weight when you are eating more of the whole food sources, right? So she switches to like oatmeal with some protein powder, and maybe like some fruit or some seeds, whatever, some nut butter. And she messages and says like, I'm full until lunch. And that did not happen with the protein cookie and collagen and whatever, right? And so that's the piece where I think it is so helpful to have a dietitian or someone on board who can look at and help you figure out what does quality look like here? What does timing look like?
Mhm.
Stop skipping meals. And start to see how those hunger and satiety hormones start to like settle down when we're pulling from the more whole foods. And the environment is like a whole nother topic. I know it's out there. I know it makes it harder to make these choices, right? When fast food is so convenient. And that's where having food prepped and on hand can be super helpful and all that.
Oh yeah. I mean, like I'm kind of going back to what we talked about, right? Merging these two is so beautiful. To understand like nothing's wrong with you. Nothing's wrong with
Right.
you. You just need to just, tweak some things around, right? And I know a lot of the clients that we work with, like there are actually in the last, gosh, 2 to 3 months, there's been a lot more supplemental support that has actually come out specifically around GLP-1s. Like I was always helping some clients before with certain supplements, but now they're specifically marketed for GLP-1s, which is
Hmm.
really cool. I mean, this is a market that's not going away anytime soon
Yeah.
or lessening, really. And so like I know that can help as well as just like keeping eyes on, things like bioflow, right? Like, stomach or, understanding that component as well. Um, because then you'll just feel better, right? And that's
Hmm.
what people ultimately want too is like this long-term sustainability. If you want to truly get off of it or even go to a lower maintenance dose, you also want to feel really good.
Yeah.
Now, a question on the lower dosing, because something that's kind of exploded in the last year has been microdosing, but I know insurances are also like that's not a thing that they do. So, talk to me a little bit about pros and cons of microdosing.
Yeah, I think there's maybe a study or two on microdosing. I would have to pull it and look. Yeah, so there's not a standard of care when it comes to microdosing and figuring that piece of it out. With that being said, we think a lot about, so like let's maybe we can talk about like someone who wants to go to like a more maintenance dose, right? And how are they doing that? So first of all, you don't start maintenance dosing at the goal weight. You start maintenance dosing probably 5 to 10 pounds higher than the goal weight, right? Because if I keep you on current dose, you're losing there, and then you just want to maintain, you're going to keep losing. So slowly titrating down or tapering down, I guess is the right word, is a really important piece. And I mean, I keep a pretty close eye on my patients again. Like I'm seeing them once a month at least. So I'm looking at their trends. I'm looking at what's going on. I'm also looking at their body composition. I have a Sika body composition scale. So I want to see muscle mass and I want to see body fat percentage and I want to see waist circumference and I want to see labs. And ultimately, I want to know how you actually feel here. So, it's really sort of an art and you have to play with the doses to figure out where maintenance lies for folks. So, some people can do the 2 point, so like we'll just go tirzepatide, right? Some people can go that dose 2.5 milligrams, and some people can go, I mean, that's the lowest dose. Some people can do that once every 2 weeks, once every 10 days, once even a month. Sometimes people will do that. That dose is nice because there's no limits or recommendations on when you go on or off because if you come to me as a new patient, you've never been on it, you get to start today. And if you want to space it out like that, that is also fine. The place where your hands start to get tied is like the 5 milligrams or higher. The recommendation is not to go more than 14 days between shots. Do people do it? Yes, I'm sure they do. Is it what I recommend? No, especially on the higher doses, because then you're like almost like shocking the system to me. And then it feels like we're running more of the risk of like maybe like causing like gallbladder issues or pancreatitis or any of those things that can pop up or just like really bad nausea, vomiting, GI stuff. So in maintenance dosing, it's really for me just sort of starting to taper down before they actually get there and then starting to push them out every 10 days, every 12, every 14, and just seeing how they feel, right? Energetically, you want to know how are you feeling on this dose? Do you like is it a real big like push for you to stretch it out and the food noise is really coming back? Maybe you need every 10 days instead of every 14, but that piece is truly like a plug and play and see how you feel.
Yeah, I mean, everybody's so unique, right?
Yeah.
And that's what's so nice about also kind of what you do as well is offering that different lens, more of a holistic, more of a personalized lens that you just don't often see, in the space. And it's not by
Yeah.
fault. You have like 7 minutes per person usually. It's
Yeah.
just not a lot of time.
Yeah.
And it's also like if somebody's saying, I feel bad, doctor, okay, well, we just shift this or change this. It's like, well, what if we just also asked the Pop-Tart question, right? Like, what do we
Yeah.
like? Is it the medication or is it something,
Yeah.
or are you in a really stressful time in your life right now?
Hmm.
Feel right that is damning the body, right?
Yeah.
I would be curious on, what are some of maybe one or two like favorite breakthroughs you've had from people who have done the traditional nutrition, health, fitness route, maybe seen a little results here and there, and then choose to go on GLP-1s.
Yeah. So, I mean, like I was saying, it's like women aren't coming to me with their first weight loss attempt, right? These are women in their late 30s, 40s, 50s, and beyond, and they are frustrated and they have lost the weight, right? They have done all these different programs, but the program only works as long as you are doing the program, right? And then the moment that they go off the program or they stop doing like the principles of it, so to say, then they're gaining the weight back. So there's a lot of nuance here in that there was a study where they found, I wish I could remember the exact statistics, but it was something like for every kilogram or every 2.2 pounds you lost, hunger hormones went up. I think it was like 3 times the amount of satiety hormone that was released. And part of that is because that brain and body, that is its way to protect you. It is trying to fight back to that set point, right? Um, but yeah, it's like I have tons of patients who, um, I always ask everyone, did you have any issues as a kid? If not as a kid, start in your 20s. Give me the history of the gains, the losses, all the things. People come in here who've lost 30, 40, 50 pounds, then they gain it back over and over and over. They want something that's more sustainable, something that will actually be able to stop this yo-yo. That's probably worse for our metabolic health than, just to be at a set point. But that's a different conversation, I guess. But so these women who are coming in here, it's like this is not their first rodeo, people. Like they have tried the things. And so when they come in here and they try a GLP-1, GLP-1s, if you're going semaglutide, that's 15 to 20% weight loss that you can expect on average. That's what we saw in the trials. And with tirzepatide, they got 21%. We have other medications like the phentermine, topiramate, like that gets closer to 10%. We can add metformin sometimes. We have Wellbutrin and naltrexone, which is Contrave. So there's other options out there, but like I have a woman right now who's lost 80 plus pounds on phentermine, topiramate.
Wow.
Granted, she's an outlier, right? Because I just told you that people lose 10%. That's a lot. She's very active. But there's pieces that people can pull. And so my biggest thing is like, I want to empower people. Like, yes, this medication can help. And how are we going to get you more active? How are we going to look at nutrition quality? Not for like a diet perspective, but like so you feel good. Your body feels better when you're giving it nutrition quality, timing it, not skipping meals, all those things. So, I mean, I've got her story. GLP-1s, I don't think I have anyone who has not lost weight on them. Um, and I mean, it is just wild, like 50 pounds, 80 pounds.
Yeah.
And honestly, it's just a matter of like keeping at it and helping them and supporting them through it and seeing what they need. Like they might not be ready to start like their strength training program on day one, right? But if I keep asking the question, maybe on month 6 when they're down 40 pounds, they have this like twinkle or like glimmer of hope, like maybe I could do that because I saw someone else do that.
Okay.
And so I just think it's so important to support them, be with them, ask the questions, and ultimately help like empower and guide their autonomy to make the decisions that they want for their ultimate vision of their health and fitness goals.
Hmm. Love that. Love this integration that we're,
Hmm.
you know. Um, Molly, if people wanted to learn more about what you do or where to find you or wanted to connect, where can they learn a little bit more about your style and how to?
Yeah. So on Instagram, I'm Dr. Molly Lupo, DrMollyLupo. I have a free email newsletter I send out every week. If you DM me, I'll get you on the list. And then my website is just mollylupo.com.
Wonderful. And you are in Nebraska.
Yep, Omaha, Nebraska.
Um, so if you are in the Nebraska area, definitely go check her out. I know you have it in person.
Yep. So my clinical practice is in person. It's sort of a hybrid model for insurance and cash pay.
Yeah.
And then my coaching practice, obviously, anyone, anywhere can get in.
Ah, amazing. Well, thank you for shedding light on this topic that is
Of
just
course.
such a good one to talk about and, speaking to all of it. So thank you so much for being here. Definitely, listeners, if you found this helpful, would love for you to share it with somebody that might need it. Leave a review or just contact Molly and connect with her if you felt like, this is something you want to explore. Otherwise, thank you for being here, Molly. Thank you, listeners, for being here, and we'll catch you guys on the next show.
Thank you for having me.
Yeah.